This is the Truly Affordable Health Insurance Podcast. I'm Jay Walks, and joining me today is Don Barkley, who is the agent, the operator, and an independent sales professional for Truly Affordable Health Insurance, representing Medicare supplements, home health care, dental and vision coverage for seniors, and more. Don, how are you?
Doing pretty well, Jay. Thanks for having me on today.
Well, it's our pleasure. Don, the first question that begs to be asked is, can I still enroll? It's January.
Absolutely. And that question has been coming up a lot lately. The open enrollment restrictions that everybody is familiar with are for Obamacare plans only. So as far as the rest of the world is concerned, off the exchange, open enrollment is every day.
So what does that mean in terms of an individual who may have had health care coverage, no longer has health care coverage, needs health care coverage now? Does that mean that they can be ready to go in a short amount of time, or is there any waiting period at all?
Well, they absolutely can still get covered. There is a waiting period only because this is real insurance, and so it does go through the underwriting process, so that can take a few weeks. However, anybody who comes to me and is able to pass some basic health questions is able to get covered any time of the year, and not only that, they can also make changes during the year. They're not stuck with the same plan for a year at a time if they need to make changes.
Now, that being said, what types of plans are available to choose from with all of these options? What do you offer?
Well, all of the normal coverage that a person would expect with a healthcare plan. So we have hospital coverage, accident coverage, emergency room, surgeries, doctor visits, outpatient coverage for, x-rays, prescriptions, all of those kinds of things. Catastrophic coverage if someone has, for example, a heart attack and needs to be in the hospital for a while. Dental and vision, life insurance, all of the normal things that a person would expect.
Is there an age restriction, or is any age acceptable?
Typically, any age, really, and most plans are, fully usable for anyone up to age 65, and at that point, of course, they would go on Medicare. And people who are going on to Medicare, we're able to help them as well with Medicare supplements and things that Medicare doesn't pay for, like dental and vision and home health care therapy types of situations. So we can help with that as well.
What about the other side of the coin? What do we offer for children?
The same thing as any other adult. So, doctor visits, hospital, accidents, surgeries, prescriptions, all of that. Same for anyone, whether they're a child all the way up to age 65.
Now, the rates are constantly changing. So how long should it have been? How much time should we allow before reviewing our coverage?
Well, I recommend everybody review their coverage annually. However, you said the rates are constantly changing. If you look at an Obamacare type plan, those plans have gone up over 150% in the last 5 years. The plans that I represent do not have those big annual increases. These are age-based plans. They go up a small amount, like 1% annually, and some of them are banded into 3-year groups. So your plan will actually not go up until every 4th year.
That being said, one of the things that I think prevents people from dealing with insurance is the concept of being sold, and perhaps sold something that, being talked into something that they may not need or may not want. Tell me about the process that happens with Don Barkley and Truly Affordable Health Insurance.
Well, I don't think I sell anybody anything, Jay. My job is to show people options. I don't make decisions for them. So So when I sit down with someone, I go through several options with them. Not too many, because I think too many options just confuse people. But I like to show them, 2 or 3 options, something that makes sense to them. And I don't even show them that until I've gone through several questions with them and I understand, what it is they're looking for and what they want. Then I show them some options that meet those needs and meets their budget. So there's absolutely zero pressure for anyone to buy anything. I present options, they make decisions.
So the bottom line is it starts with an initial consultation, folks, and it can be as simple as a phone call. Take this number down, won't you please? 785-979-0722. Again, 785-979-0722. You can also visit the website at www.trulyahi.com. Again, trulyahi.com. Don Barkley operates Truly Affordable Health Insurance. They help individuals and businesses with alternatives to Obamacare, lower premiums and deductibles, no restrictive networks or enrollment periods, and dental, vision, and Medicare supplements, and much more. Don, thank you so much for being with us today.